my name is Tiffany, and I'll be discussing my health intervention of maternal and infant mortality amongst African American women. Three highlights of this people in my community is that I plan on targeting African American women who are pregnant or planning on getting pregnant that are located in Trenton, New Jersey. These women are often underrepresented in the area, and they have a high prevalence of health disparities and social determinants of health. They also suffer economic challenges such as high rates of poverty, unemployment, and lack of affordable housing. Three highlights of this environment is that it is located in Trenton, New Jersey. Trenton is also the capital of New Jersey with a population of 89,661 citizens as of 2022, located in Mercer County, and it is ranked as the 382nd most populous city in the country. Three highlights of my health issue is that this is high rates of maternal and infant mortality due to health disparities amongst African American women, due to systematic racism and implicit bias in healthcare. About 287,000 women have died during and following pregnancies, such as in 2020. Almost 95% of all maternal deaths occurred in low or lower middle class income countries in 2020 as well, and they could have also been prevented. The top three researchers for this issue is that it is World Health Organization, Centers for Disease Control and Prevention, and the U.S. Department of Health and Human Sciences. This intervention shows cultural humility by addressing structural inequalities for socioeconomic status, healthcare access, and the overall environment. This intervention allows the community to get together to overall have a support system, expand health literacy, and let women share their experience and challenges that they went through during their own pregnancies as well. As women try to get pregnant, it is currently a challenge that they really do need more support and encouragement, and they have to have the best health care to have a successful pregnancy. Three ways that my intervention will help will benefit this community is that it will address historical inequalities, structural barriers, and it will have focus on women empowerment to take charge on their maternal health. By doing research and supporting the effectiveness of my research for this intervention, the main cause is to reduce maternal and infant mortality amongst African American women. By doing this, community health workers are often members of the community, and their role in providing health education, support, and navigation of the healthcare systems. This has been a great way to reduce barriers to care and improve patient care and patient engagement. In addition, doula care has been shown to be one of the positive impacts on birth outcomes, and it has helped underserved populations. Doulas provided continuous and physical emotional support during pregnancies and labor, and it helped reduce stress, improve birth experiences, and supported information decision making for people who are in need. To gain and retain participants, I plan on building partnerships and reliable sources amongst the community with also local influencers, health administrators, and nonprofit organizations. I also plan on using social media platforms to share and widen my bracket to let people spread awareness about this intervention and have engageable and shareable content. To make this appropriate valuation process for my intervention, I plan on first defining the goals and the objectives of the intervention, which is also to reduce maternal and infant mortality rates, improve access to prenatal care, and increase knowledge about maternal health risks, and enhancing self-advocacy and decision-making amongst Black African American women. Data that is going to be collected is like surveys, questionnaires, and in-depth conversations and interviews with participants who choose to go through with the interview, and home visits with the women who actually let us come to their homes and check up on them to see how they are doing and collect feedback. An appropriate upstream for this health issue is addressing structural racism in healthcare and ensuring access to quality healthcare, food insecurities, nutrition, and improving education and health literacy. I do feel like I'm not an expert, but definitely an educator about this overall community, environment, and health issue. I feel as though I did learn a lot about the information and significant amount of knowledge about this community, and I definitely studied a lot about this issue and learned that this is a serious issue that has to be taken care of immediately because women are dying, kids are not being able to live as long as they can be, as and women as well, and this issue definitely has to be solved immediately. As a health educator, my role in this paper was to conduct a needs assessment, gather data about maternal and infant mortality, and involve existing data and new data to come together to see what I could do to make a solution to this issue. Now that this paper is complete, I plan on using this information and make a drive to have a change and improve maternal and infant and health outcomes, infant and maternal health outcomes in African American communities. Specifically, my intentions would include the following, which is presenting issues to policymakers, engage in further research and evaluations. Thank you.